Bismillahirrahmanirrahim. Now we are going to see the different muscle group of the lower limb. So you can see that we have the gluteal region, then we have thigh, and then we have leg, and finally we have the foot. So we'll start first with the gluteal region muscles. Now gluteal region muscle, you can see that they're big muscle, they're easy to identify, and as I said to you in the beginning that these muscles are taking origin from the posterolateral surface of the iliac bone. Now this muscle is the gluteus maximus muscle. And then anterior to this we have the gluteus medius and minimus. So now if you want to see, you can see that the gluteus region muscles are divided into two groups. One is called superficial group and one is called deep group. So these are the superficial group, the gluteus maximus, medius, minimus is deep. And then to see the short muscles or the deep muscle, we have to remove the gluteus muscle, and then we'll go and we'll see it. So now let's go, let's cut the muscle, gluteus muscle, and go to the deeper region. And in deeper, you will see the short muscle. Now there is important thing to know about the short muscle, that they all are the lateral rotators, and they are starting from the piriformis to gemelli, that is gemelli superior inferior, obturator internus, and we have quadratus femoris. So these are the short gluteus muscle, and they all are the lateral rotators of the thigh. So now what is the first muscle and how to identify this? The first muscle is the piriformis. This is important to know. This is the piriformis, and from the lower border of the piriformis you will see there is one thick muscle, or the thickest muscle of the body is coming out, and this the thickest nerve of the body is coming out below the lower border of the piriformis, and this nerve is called as the sciatic nerve. So this is very important. How to identify the sciatic nerve? Another way, sciatic nerve, you can see that it is coming just below. You just identify the piriformis, and you will see that just below the piriformis this huge nerve is coming. So this is the sciatic nerve, the thickest nerve of the body. Fine. Now let's go to another muscles group. It's difficult, but okay, yes, we'll try to find out. So all other muscles are deep to, you can say, anterior to this sciatic nerve, because we are looking at it from the posterior. So this is sciatic nerve, or deep to the sciatic nerve. You will see this muscle starting from above. We have gemellus superior and gemellus inferior, and in between gemellus superior and inferior you will see there is a small tendon coming, that is called as obturator tendon. So it's very difficult, but at least you can see that from above downward we have gemellus superior, then obturator internus, and then we have gemellus inferior, and the last one here, which is in quadratus shape, is quadratus femoris. So the last one is the quadratus femoris. So piriformis here, two gemelli with obturator. Sometimes they are called it as a tricipital tendon because they are attached on the same place. So here we have the piriformis. Below the piriformis we have the gemellus superior, obturator, gemellus inferior, and the last one is the quadratus femoris, not quadriceps, quadratus femoris, and they all are attached to the superior border of the greater trochanter of the femur. Again, I told you that the greater trochanter is important for the attachment of the muscles. So these muscles, the short muscle, the lateral